Complex regional pain syndrome, and especially in the younger athlete, is something that we should always acknowledge. And probably to give you a better understanding of this, I'll talk about a case we had recently, and it makes it a little easier to understand. We had a young 12-year-old female athlete who came in to consult us. She had excessive pain in the knee joint. And these are the points we need to really consider that will make us think that it could be this condition. Number one, she's female and she's about 12 years of age. 2, she had a very small, slight incident to the knee. It was a climbing incident. 3, she had an MRI that showed nothing. She had a normal knee, and the pain was very much disproportionate to anything that was going on with the knee, never alone the fact that the MRI was completely normal. Obviously, for the knee joint, we needed to make sure that we cleared the hip and there was nothing going on in the hip or the back. And so these were some of the things that tweaked us to think there's something not quite right about this. I was lucky enough that I've seen 5 of these conditions over 30 years. And what we do know is that you can get a very slight incident that it can occur to an ankle, wrist, or what have you in this age group, and they get huge amounts of pain to the point that I can't even touch the knee, I can't bend it, really hard to try and straighten the knee, impossible even to get them on the stationary bike. What also compounds on this is that often these patients go and see lots of different practitioners and physios, surgeons, multiple testing. No one can come up with a diagnosis. So complex regional pain syndrome, we really need to be highly suspicious of this when we have these highly disproportionate amounts of pain. Obviously, we mentioned before we need to clear the hip joint, which we did. We also can do a number of blood tests to make sure that they don't have an underlying inflammatory arthritis or seronegative spondyloarthropathy, which are arthritises or inflammation within the joint. And if we're clear of all that, by a matter of deduction, the only thing that we can have is a complex regional pain syndrome. We've been lucky enough to deal closely with a professor in Adelaide, Professor Kundi, and he helps specialise and give us information about these things. If everything is clear and there's this hypersensitivity, we have to do a number of things. 1, aggressive physiotherapy to move the joint quickly on a bike, get them in the pool. Try not to put them on crutches, try not to put a brace on them, because this seems to add to the condition. And we know that if we can move them quickly, we're not going to go down this spiral. In the cases I've seen, the 5 cases, there's been common factors. 1, they've seen multiple people who haven't got it moving quickly enough and have been too gentle with the treatment. 2, they've been females and they've been about this age group, 12. 3, MRIs are clear and all other tests are clear. And so our approach needs to be aggressive treatment. We need to talk to the parents to explain to them what this condition is. And then often in really severe cases, they may need to go and see a specialist, a pain management specialist. In this last incident with this young girl, we found the use of Lyrica, quite a high dose, which is a type of neurological medication, seemed to be effective. Now, whether that was placebo or not, it did make a difference. But again, I think we need to be very aware that if you ever come across either your children or other patients that have this excessive pain in a joint that's disproportionate to the actual injury, you need to seek an experienced physiotherapist or an experienced orthopedic surgeon, and also talk to them about complex regional pain syndrome, called CRPS is the algorithm. It used to be called reflex sympathetic dystrophy, but I know a lot about this condition through past experience. I'm more than happy to discuss this with you. And thus the final thing is, again, if you have anybody that's really suffering with this and they're a little bit unsure if this is the condition, I'm more than happy to help them. Thanks very much.